Welcome to QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live 2024 in Dallas and online. Today's case is your JAK inhibitor patient is in the hospital. Doctor, what do you want us to do? This is a phone call that you may get like I got 2 weeks ago. My patient, 62-year-old woman, she's taking methotrexate. She's on a JAK inhibitor, doesn't matter which one, and she is on 5 milligrams of prednisone, and she's been sort of controlled, always has a CDAI score of between, 5 and 12, and maybe 1 or 2 swollen joints. She, doesn't have she's not in remission by HAC score. But she's still functioning, and she's coming to see you, and she's getting follow-up, and she's been on these therapies for like more than 4 years. She's got 8 years of rheumatoid arthritis, so has been around the block on medicines, and finds that the methotrexate plus JAK inhibitor has given her the most degree of control. So think about this. She is on methotrexate and a JAK, but she's had 8 years of disease, which means that she's failed, 4 or 5 other biologics and or targeted synthetics to get to where she is today, and she's not perfectly controlled, but she's better controlled. This is a difficult patient. This is a patient who's at risk for a lot of bad things. The longer RA goes on, the more inflammation, the more recalcitrant you get. You're more likely to get comorbidities. You're more likely to get side effects of medicine. But is it really from the medicine, or was it from the inflammation and the uncontrolled RA that got you hospitalized or infected or whatever? So this patient's in the hospital. She's on prednisone, methotrexate, and a JAK inhibitor. What are the reasons that she would be hospitalized for? To the top of your list, you probably would say an infection. And I think that's reasonable. But as I've always taught, you have to, is it RA or is it the drug? And it's always more likely to be RA and inflammation than the drug, but it's hard to disentangle the two. So often the drug, in this case, everyone's going to hold the JAK inhibitor. In fact, you should probably be holding all the drugs because they're all responsible if the JAK inhibitor is responsible. But no, we hold the JAK inhibitor, and then maybe because of this being her third infection, we move on to another biologic or targeted synthetic. I don't know. What kind of infections would she be in the hospital for? Hopefully not a cold, but she could present with either COVID or with influenza or even RSV. And all of those certainly being preventable. She could present because of pneumonia, which is the most common cause of death, infection being the most common cause of death, and pneumonia is the most common cause of infectious death in RA patients, irrespective of the therapy that they're taking. So pneumonia would be a real possibility. And again, now you're going to have to differentiate. Is this just a serious infectious event? Or could this be an opportunistic infection, such as TB or fungus, one that might be predicted by the mechanism of action that you're looking to target by your therapies? So again, it's important to know what the possibilities are, because when you know the possibility, you know what the response is going to be. I'm a big proponent of vaccination in patients with RA, and that include influenza and COVID and RSV, because I think our patients are all at risk. And specifically patients going on Zoster, I don't wait until they're over 60. I vaccinate them all against Zoster with the recombinant Shingrix vaccine. That works very, very well at all ages, 40, 50, 60, 80, 90. It works equally well and should be used. To get reinforcement on this, I really strongly recommend that you attend RheumNow.live, where Dr. Kevin Winthrop, who is a professor of medicine, infectious disease, and rheumatology, and all things wonderful. Kevin's from the University of, the Oregon Health Science Center in Portland, Oregon. He's going to lecture on safety issues with the JAK inhibitors, and he's going to address this issue of vaccination with JAKs and probably other vaccinations while he's at it, and he'll take your questions on the safety issues that may surround JAKs. For instance, are they really at risk for TB and opportunistic infection, or is it only zoster that they're really at risk for? Are they at risk for colonic perforation, just like the IL-6 inhibitors? Yes, they are. What is the liver risk? What is are there other risks that I'm not yet aware of? Hematologic, liver. Anyway, Dr. Winthrop's going to cover this at RheumNow.live in Dallas, 6 weeks away. Register now.